To A Tale of Two Pandemics, Substance Use Disorder in the Age of COVID-19. My name is Katherine Haley from Bristol Community College. So, over the last year, COVID-19 has claimed the lives of over 500,000 Americans. Due to the pandemic, we have had social distancing and shelter-in-place orders. And by June of 2020, we had already begun to see the effects of isolation. In a survey of 5,412 adults at that time, 40.9 reported at least one adverse mental or behavioral condition. Of that 40.9, 13.3% revealed that they had started or increased their substance use to help them cope with the COVID-19 pandemic. So while COVID-19 has been tragic in its own right, it has also taken a toll on addiction and recovery communities. In 2020, the United States had a 6.8% increase in overdose deaths from the previous year. This is the highest increase in recorded history, going from 70,630 in 2019 to 81,000 in 2020. Massachusetts, however, has managed to stay far below that number at just a 2% increase in the first 9 months of 2020. Within the New England region, in roughly the same time period, fatal overdoses increased by 26% in Rhode Island and 24% in Maine. In short, the American Medical Association wrote to the DEA in November of 2020, and in that letter, they said that 40 states have seen an increase in overdose deaths during the COVID-19 pandemic. So this leads us to a question. What is Massachusetts doing to mitigate a drastic rise in overdose deaths during the COVID-19 pandemic? While we've seen an increase, it hasn't been anything like other states in the area. So first I looked into detoxes. These are acute treatment facilities for the first leg of detoxing from drugs. Massachusetts has 178 detox facilities that take state insurance and are state run. They take things like Medicaid and Mass Health. Rhode Island has about half that. Many inpatient facilities have had to limit their capacity due to COVID-19 to keep people socially distanced. So the more treatment facilities we had available before the pandemic put us in a better position in Massachusetts to treat addiction when the pandemic hit. So to understand the importance of my next point on homelessness, we must first look at Maslow's hierarchy of needs. At the bottom, you see air, water, food, shelter. These are integral to life. And Maslow says that we need to meet those basic needs before we can move up in the pyramid to things like safety needs, which include health, or to self-actualization, to be the best version of ourselves. So many homeless shelters are considered dry shelters. That means that you cannot be using drugs or drink while you're in the shelter. In Rhode Island, after calling state agencies such as the Rhode Island Coalition for the Homeless, I was only able to find one homeless shelter that was considered a wet shelter, meaning you did not have to be completely clean to stay there. And that's Crossroads in Providence. New Hampshire has no wet shelters at all. You must be completely clean. And if they think that you're under the influence of drugs or alcohol, they will drug test you or breathalyze you and kick you out. In Massachusetts, there are 39 emergency homeless shelters funded by the state. Of those, 18 are considered wet shelters where you do not have to be completely clean and sober to receive help. So if you come in and you seem intoxicated, they will ask you to go to your room so that you don't disturb other members of the shelter and to stay out of common areas, but you're still given that basic level of physiological needs that's met. So you can start to think about your health and about being the best version of yourself, and that might include getting clean. Next, I looked at aftercare. So it's been shown that longer stays in treatment facilities and structured programs, it helps individuals suffering from substance use disorder achieve long-term recovery, which is considered 12 months or more of abstinence. Massachusetts funds several options for long-term treatment, including recovery high schools for teenagers, residential services for families so that children can stay with their parents in a safe, monitored setting. There are recovery homes, intensive outpatient programs, and many, many more. Massachusetts also distributes large amounts of naloxone, which is an overdose reversing agent. So if you are experiencing an overdose and you're given naloxone, it will reverse the overdose. They give it to both individuals who may be more likely to have or witness an overdose, as well as first responders. There are also community programs where recovery specialists will partner with first responders and go to a home where an overdose has occurred. They will encourage the individual who overdosed to get treatment, but if they're not interested, they give their family, roommates, and the individual naloxone, teach them how to use it, and encourage them to use clean needles. By late 2020, there were 34 towns and cities that offered needle exchange services. So while that's very important to lessen the spread of bloodborne illnesses like HIV and hepatitis C, they can also be a place where individuals go to get information on treatment. Next, Massachusetts decided to launch a couple of public awareness campaigns that have been very effective. In 2016, they expanded the Good Samaritan Law to protect addicts who call 911 to report an overdose, and that protects them from arrest if they are using or possessing illegal drugs. The campaign that they ran with commercials on television and billboards is called Make the Right Call. This made the public aware of the expansion of the Good Samaritan Law and stressed calling 911 for an overdose and that it will not result in an arrest for illegal substance under any circumstances. Another wonderful program that I personally love is called State Without Stigma, which encourages all Massachusetts residents to be supportive of addicts in recovery as well as those seeking recovery. They just came out with a new video for State Without Stigma in November of 2020, and they continue to bring awareness to the stigma of addiction and how to combat it, as well as how to be a good ally to those suffering from substance use disorder. Finally, we're going to talk about medication-assisted treatment in Massachusetts. Despite the reported success of MAT programs, the biggest barrier in this mode of treatment in the United States continues to be access to them. Now, the most common forms of MAT are methadone, buprenorphine, and naltrexone, and they each have their own special abilities and all their own drawbacks. Massachusetts has shown its commitment to these programs by creating the Medication-Assisted Treatment Commission under the direction of the governor. Their stated goal includes examining any barriers to MAT programs in the state and projecting a future need for more MAT programs in Massachusetts. Having an entire task force on this issue could very well be one of the reasons that Massachusetts has stayed below the national average during the COVID-19 pandemic. So right now we're seeing the past, present, and future collide. Massachusetts is doing much better than the national average on overdose deaths, but it and most of the country still have a long way to go in terms of efficacy of treatment. The legislators who created the Harrison Act in 1914 put a deliberate loophole in that act. Now, this act put a prohibition on all hard drugs, cocaine, morphine, heroin, but they made it so that doctors could still prescribe drugs like heroin and cocaine to addicts to treat their addiction, so they didn't have to go and engage in criminal activity to get their drug. Now, in the late 1910s and the 1920s, 3/4 of self-described addicts, these are not just users, these are addicts, had steady and respectable jobs. Some 22% of addicts were wealthy and only 6% were poor. Although it would have been better for them to stop, they were rarely out of control or criminal. Harry Anslinger, who was the first head of the Bureau of Narcotics, decided to prosecute doctors who were legally prescribing narcotics to addicts at the time, and he effectively closed that loophole and put doctors on federal probation, which took away their power to prescribe. By putting a prohibition on doctors, Anslinger was, in effect, creating an illegal drug market with customers willing to do whatever it takes to get the drug they were addicted to, often leading to criminal behavior which they had not previously been engaged in. This also led to a lot of gang violence. More than 75% of drug-related violence is, in fact, gang violence and not the result of an addict harming someone to get high or causing them to act violently, the drug. So we basically served up on a silver platter this illegal drug market. I want to talk to you a little bit about Rat Park. In a study done by Bruce Alexander, he conducted an experiment on rats. Rats are very social, sexual, industrious creatures. Some of the rats he kept isolated with just one regular water bottle and one drugged water bottle, either with cocaine or morphine. In another cage, which he dubbed Rat Park, and you can see in this picture, they had tons of balls, tons of things to roll around, things to jump on top of, and other rats. Most importantly, they had other rats to play with. Now, in the isolated cage, they almost always used the drugged water compulsively, often until they overdosed and died. But in Rat Park, they didn't like the drugged water. They rarely used it at all, and when they did, they never used it compulsively. This begs the question, what if addiction isn't about the chemical hooks of drugs like heroin and cocaine? What if it's about the cage in which the addict resides? Portugal has created a great framework with which to pull ideas from on how to change the drug treatment in the United States and how we can change the addict's cage. The money used to formally imprison addicts is now used for educating kids and treatment for addicts. So they have decriminalized all drugs, and they are using that money to treat addicts and educate children. If someone is willing to hire a newly abstinent addict, the Portuguese government pays half the wages of that individual for a year. And when that year is up, often the worker remains at that job. After 20 years of this decriminalization/reintegration policy, the results are clear. The rate of injecting drug use in Portugal has gone from 1 in every 100 citizen to 0.5 in every 100. It's literally been halved. In that same period of time, intravenous drug use has doubled in the United States. These basic changes to their system, which was as punitive as the one the United States has 25 years ago, has created a connection back to the community for the individual with substance use issues. They get to wake up with a purpose and serve their community, becoming reintegrated into social life in their communities. Just recently, Oregon decided to try out the Portuguese model of drug treatment by passing Measure 110. If an individual is found to have a small amount of any drug for personal use, they will not be arrested or jailed. Instead, they will be issued a fine of $100, which they do not have to pay if they agree to a health assessment. Fewer arrests and incarcerations, as well as taxes on marijuana in the state, will free up funds for addiction treatment. Oregon is treating addiction as a health issue rather than a criminal issue. This new program went into effect this year on February 1st, and I look forward to following it. So, what does this mean for Massachusetts? We've always been an innovative and socially responsible state. We were the first state to have a public park, the first free public school, the first public library, the first abolitionist newspaper, and the first state to legalize same-sex marriage. Our approach to addiction is working better than most of the country and is mitigating overdose deaths in the era of COVID-19, when so many people do not have access to the care that addicts in Massachusetts do. So these wonderful social programs I've told you about have mitigated overdose deaths in this state, but we could be doing more. I'm hopeful that we will follow Oregon's lead in our approach to addiction treatment. Addicts' morals aren't the failure, their health is, and it should be treated as such. Thank you so much for coming, and here are a few of my references.